Respected teachers and friends, hearty namaste to all of you. The topic of today's presentation is lesson plan. But before we move on to the lesson plan, let us see a very interesting incident. The incident occurred in the year 1663. It was the year when Maharashtra was ruled by Shivaji Maharaj. And Shivaji Maharaj was becoming so powerful that the king of India at that particular time, King Aurangzeb, got very worried and he sent his maternal uncle Shaista Khan to confront Shivaji. Shaista Khan comes to the south Dakhan at that particular time with a very vast army. And what Shivaji does he confront Shaista Khan? No, he resides back to the safe havens of Sahyadri. Shaista Khan reaches up to Pune and begins to stay in the Lal Mahal. What happens after the 6 months? Nothing. Is Shivaji doing nothing? No. Shivaji is planning while being there in the safe havens of Sahyadri. And what Shaiste Khan is doing? Shaiste Khan is absolutely doing nothing and relaxing in the Lal Mahal. And what happens? One day, disguised as one of the men in the marriage party, Shivaji Maharaj enters the Lal Mahal and the harem of Shaiste Khan. Nevertheless, Shaiste Khan escapes, but his four fingers are being cut by Shivaji, and that was a surgical strike. Shivaji again recedes back to the safe havens of Sahyadri. The Shaista Khan was a bit cranky fellow. Even after this, he continues to stay at Pune in the Lal Mahal. But King Aurangzeb was an intelligent person. He sent Shaista Khan a letter. This letter goes something like this. Dear uncle, Shiva is a great planner. He will not call him Shivaji because G is giving respect. Shiva is a great planner, quick learner. Next time he will impart a lesson by relieving your neck of the burden of your head. Leave Deccan immediately and go to Bengal. And Shaista Khan leaves Deccan, goes to Bengal, stays there as the viceroy till the end of his life. The words used here are planner, quick learner, impart a lesson. What do we get out of these particular incidents? We can conclude fairly that to teach or impart an effective lesson, one should have a good plan. So this is exactly is the type of discussion today, that is we have to discuss about the lesson plan. I am Swanand and I will be discussing regarding the lesson plan. What are the learning objectives? At the end of this discussion, we should be able to first define what is a lesson plan. Secondly, describe the characteristics of a good lesson plan. Enumerate the steps in the lesson planning and write a lesson plan. We will have an example also. So what's the lesson? A lesson is a structural period of time where learning is intended to occur and involves one or more students. Surprisingly, if you see this particular definition, then it says it involves one or more students. There is no mention of teacher there. The lesson is structured period of time where learning is intended to occur. Now I will give you an example. Suppose you are reading a newspaper and in the newspaper for the first time you come to know that Shri Kovid is India's president. Then the learning has taken place. But is there any teacher there? No. Whenever you read a book, learning takes place. Is there any teacher there? No. So there may or may not be a teacher when learning is intended to occur but involves one or more students. An insight gained by the learner into the previously unfamiliar subject is very important. The subject should be previously unfamiliar. If the person reads again and again that Shri Kovid is India's president, then the learning is not taking place. The learning took place only when the person read it for the first time, when it was unknown to the person. Let us see what we mean by plan. It is a detailed design of doing or achieving something. Yes, we have a plan of something. Suppose we want to construct the house. Do we go like that? No, we do have a plan. And plan is something which can be put on the paper. So even in the lesson, there should be a plan which we have to put on the paper. We should be able to put on the paper. Now coming to the lesson plan, what do we mean? Lesson plan is a document or instructor design or roadmap of which students need to learn how it will be done effectively during the class time. So what it is, important thing, it is a document. So lesson plan is a document. We should be able to put it in the form of a document or roadmap that students need to learn and how well they need to learn and what is your plan about that, what you are about to do so that the student learns better. What's the purpose? Definitely. For the teachers, it is help us to think in details how to approach our teaching. It helps us to approach our teachings better. Secondly, what is the most effective way to help the students to learn? There might be different ways in which the students might be taught, might be in a didactic lecture, might be having a discussion, might be having a problem-based learning, might be showing them some mannequins. So it is the best way for the student to learn. Organize content, time and strategies. It is not like that we are being given as much time as possible. Generally the time is given is 40 minutes or generally the time is given is 1 hour. So we have to organize our content, time and strategies in that. Assess the students learning. It is not only that we have to assess at the end of the class, that is how much student has learned. So assess the students learning. So approach, effective, organize and assess the students learning. What is the characteristics of a good lesson plan? If we want to see the characteristics of the good lesson plan, we have to see a lesson plan which was most effectively delivered. About 6,000 years back, it is said that this lesson plan was delivered and still we consider it as the best lesson plan. What is this? It is Bhagwan Shri Krishna delivering a talk to Arjuna in Kurukshetra. We know. And what is being utilized, what we will be having on this side, is what is being mentioned is medical education technology. And this plan exactly uses that, or I can say that what this plan uses is exactly what is there in medical education technology. Let us see. The first, it is based, it should be based on previous knowledge, isn't it? Shri Krishna knew previously what was the knowledge of Arjuna and accordingly he proceeded with. So we should know what is the knowledge level of our students. Secondly comes to the level of the student. The whole of the Bhagavad Gita which was narrated, it is coming to the level of Arjuna in his own language which he understood, Sanskrit, and that too a very simple Sanskrit that is being utilized. Uses the motivational technique. The whole Bhagavad Gita is motivational technique only. Arjuna was sitting in his chariot saying that I will not fight, but ultimately he got motivated and he continued to fight. So it's a motivational technique. You should be able to motivate the children. Includes necessary materials. So audio visual aids. Does Sri Krishna use audio visual aids? Yes. In one of the chapters in the Bhagavad Gita, which says Vishwarup Darshan Yoga, what Sri Krishna gives Arjuna is Divya Drushti. That is, he gives Arjuna a type of vision that Arjuna sees that Sri Krishna or the Lord or the God is everywhere in the world. So it includes necessary audio visual aids. It is interactive. Does Bhagavad Gita only has Shri Bhagwan Vacha? No, it has Arjuna Vacha also. Arjuna is also being given an opportunity to ask various questions to the teacher. So it's a altogether interactive and has appropriate time location allocation. Bhagavad Gita was not told on a long duration of time. It was, if you recite Bhagavad Gita properly, it can be recited in a 1 hour or 1.5 hours. So it's an appropriate time allocation that is being given. And finally, it includes evaluation process. Did it include evaluation process? Yes, the war itself was an evaluation process for Arjuna. So this Bhagavad Gita gives us that what we should have in our lesson plan. So characteristics of a good lesson plan, it should be based on the previous knowledge. Person comes to the level of the students. It has a motivational technique, includes necessary materials, interactive, has appropriate time allocation, and has evaluation process at the end. What is the structure of a lesson plan? How it looks? Let us see. It has input, it has process, and it has output. Three components. What do we have in the case of input? Input refers to the information about learners. What type of learners I have? Whether I have first year students, second year students, final year students, postgraduates, or my fellow teachers in front of me, accordingly I will suggest different, or I will have different lesson plans. AV or physical materials available, whether which are the audiovisual aids which is available to me. If chalk and board is the only thing available to me, I need not think about the audiovisual aids, other audiovisual aids like overhead projectors and all. Then the teacher, what's the qualification of the teacher? What the teacher is able to teach the best. So that is what the thing is. So that is what an input. What do we include under the process? Process is the actual plan. So now this is the most important part of the lesson plan, that is the process. Process is actual plan which is there. What do faculty and learners do during the session? Now the session is there, suppose for 1 hour. What the faculty will do, what the student will do, and that precision is there in the process. And output refers to what student is supposed to learn. Right in the beginning, we should know what the student is supposed to learn. Only then we will have a proper assessment of the student with using proper assessment methods. Did the student really learn what was supposed to be taught? So we should have method to answer this particular question. How well the learning is measured? Assessment methods, that is very important. What are the various steps in planning the lesson? Let us see what are the steps. Lesson plan. Let us take an example and then the things will be very clear. Since I am a pharmacologist, I will take one topic, that is pharmacology of asthma and introduction. This can be understood by anybody. It's a very simple topic which is there for any faculty. This can be understood. That's why I have taken this topic. Now I want to prepare a lesson plan on pharmacotherapy of asthma and introduction. What I will do? Step 1. Decide on the input. Student and their level of understanding. I want to teach the students of second year MBBS. My approach will be different. If first year, my approach will be different. Here the case is second year MBBS. I will use didactic lecture as the method. I can also show the video because I have the audio visual aids available with me. I will be able to use the animations. I can draw a diagram using the chalk and board, and even I can go for discussions. Not only that, I have also in my armamentarian role play, quiz, group discussion, even PPL. I can use all of them or some of them or one of them to discuss this particular topic. So this is deciding on the input. Step 2 is introduction. How I will introduce the topic. That is called as set induction. Never set induction by telling the students that this particular topic or this asthma is a very important disease. It is number of people affected by this disease each year. They are not interested. You can just set the induction by telling them that some long answer type of questions, notes are being asked on this particular chapter. Since last 3-4 years, it is not being asked. So this time it is very likely. Or you can tell them that this was the disease which Dimple Kapadia suffered in the movie Dabang 1. They will be quite interested to know that it was excellently enacted by Dimple Kapadia in that particular movie. So that is what is setting the induction. And don't worry about setting the induction. Not all the class will be set on induction. There will be few students in the class, whatever you do, they will not be set to induction. Then in that case, you have to just take care that they are not disturbing the class. So review what was previously taught. So in this case, what I will review? A kind of physiology of the respiratory system, anatomy of respiratory system. I will brush through it because they have already have learnt it in their first year MBBS. I will allot a time. So time is important. 5 minutes for this. What's the step 3? Discuss the objectives. I will discuss the objectives. At the end of the discussion, right in the beginning, we should have this slide. The learner should be able to first explain the physiology of breathing. Second, describe the pathophysiology of asthma. Thirdly, classify the drugs for the treatment of asthma. This is the core. Illustrate the mechanism of action of salbutamol. So these are our objectives and the student should know the objectives well. Please spend a lot of time on this particular slide. Generally this slide is being shown but for few seconds. No, this slide is should be explained. I will explain it in 5 minutes. What do you mean by describe, classify, illustrate and why these objectives are there. Step 4. The method of activity. Describe the physiology of breathing. I will describe the physiology of breathing, but what I will use? Animation for the same. Describe the pathophysiology of asthma. What I will do? I will use a video clip for describe the pathophysiology of asthma. Classify the drugs for the treatment of asthma and altogether I will like to write on the board because I want to make this particular fact known to the students that yes, the classifications can be remembered and those can be reproduced on the board. So writing on the board. Describe the mechanism of action of salbutamol. What I will do? Using the chalk and board method and show the students the inhaler, how to use the inhaler. And I will devote 25 minutes for that. So method of activity, longest time you have to devote for method of. So I will use animations, I will use video clip, I will use writing on the board and demonstration of the inhaler to the students in those 25 minutes. Step 5 is summarize. I will summarize by quick show of the slides to the presentations to the students once again and I will devote 5 minutes for that. So see what you will do, how you will do and how much time you will give it. That is something which is being previously decided in the case of a lesson plan. Step 6 is interaction. So questions from the students. I will ask the students whether there are any questions. So I will give 5 minutes for to the students. Assessment. What? Questions for the students. Now I want to assess whether my objectives got fulfilled. I will be using here a kind of scenario. I will give them a scenario of the case of bronchial asthma and ask them to analyze that particular case. I will give 3 minutes for that so that I will be able to know whether the message I wanted to give in terms of the introduction to asthma, whether it has gone straight or not. Step 8 is next learning plan. This is not all about asthma. This was just an introduction. Now I will tell them, right? Other drugs, treatment regime and status asthmaticus is something which is remaining and which we will be dealing with in the next of the discussion. So it creates a thread. It creates a continuity when you tell regarding the next lesson plan. So these are the 8 steps, and I will devote 2 minutes time for this particular purpose. So lesson plan, I have 8 steps, but this is my way of doing the things. But in the lesson plan, it's very flexible. It's your way, can also you have your own way of describing the things. It need not be very robotic, as in the case of teaching, it's an art. So it should not be very robotic. It is not restricting somebody, but it should be what? It should be flexible. You can use your own plan. You can use your own methodologies for teaching the students. For setting the induction, you can even use some case scenario for this particular purpose. So that is how the things which are there. Or you can have the introduction in the form of some other ways. You can have the assessment in some other ways. So that is what the flexibility. So let us not be robots, but let us be flexible and very artistic enough, because teaching is an art. Teaching is a science. That's okay, but it's an art moreover. So let us be flexible about that. But how we represent a lesson plan? We told that plan is something which has to be represented on what? On a paper. So how to represent a lesson plan? Let us see this. This is how the lesson plan is represented in the form of table. Pharmacotherapy of asthma and introduction. Components, decide on input. Time is not required because this is something before the class. I have time with me before the class as much of. So students and their level of understanding. Here it is second year MBBS. Lecture, video, animation, drawing, diagrams and discussion. That is what I will be utilizing. Introduction 5 minutes. Set induction, movie example, questions asked in the examination, review what was taught previously, anatomy of the respiratory passage, also the physiology. Discuss the objective. I will devote 5 minutes. So components, time and example, explain the physiology of breathing, describe the pathophysiology of asthma, classify the drugs for the treatment of asthma, illustrate the mechanism of action of salbutamol. Method of activity, 25 minutes, describe the physiology of breathing, animation, pathophysiology of asthma, video, classify the drugs, I will write on the board, describe the mechanism, I will write on the board, and I will show them the inhaler, use of inhaler, summarize. To summarization, I will devote 5 minutes, quick show of slides of the presentation, interactions, 5 minutes, question from the students, any questions from the students, assessment for 3 minutes, question for the students in the form of a scenario, next learning plan 2 minutes, other drugs, treatment regimes and statuses. So total duration is 55 minutes. I have been given 60 minutes for that. So 5 minutes for here and there for students to come and go, and again if we want to record the attendance, etc. So for that we can devote 5 minutes for that. So exactly what you want to do, what is the sequence of that doing, what is the time provided for that, and what methodology you will be using, that we have to depict in the lesson plan. So what were our learning objectives? These were. Whether we have fulfilled that, let us see this. At the end of the discussion, we shall be define what is lesson plan. Have we defined? Yes, we have defined it and said that there should be learners in the lesson plan. That is what is most important. Describe the characteristics of the good lesson plan. We have taken the example of Srimad Bhagavad Gita as a very good lesson plan. Enumerate the steps in the lesson planning. Have we enumerated the steps? Yes, we have enumerated the steps. There were 8 steps in the lesson planning. So that we have done. And write a lesson plan. Have we written a lesson plan? Yes, by taking the example of introduction for the treatment of bronchial asthma. So that lesson plan we have done. So we have fulfilled our objectives. So thank you very much for your patient listening. I hope this will be helpful for the teachers to plan their lesson and to make their teaching more effective and learning more fruitful. Thank you very much.